What is up, Decatur? This is Dr. Waldeck with Health Source of Decatur, and today I've got an important question for you, and that is, do you have Psoas? Okay, and the answer is yes, you do. You've got 4 of them actually. You've got a Psoas major and minor that act pretty much as one muscle, and you've got one on the left and the right. Okay, and what is important about this muscle is it attaches to the lumbar disc. We're going to take a look at what that looks like here. Okay, so here we have the spine, just like we're looking at here. This way is forward. So it's attaching to these lumbar vertebrae, and it also has attachments at the discs in between these joints, which is really important. We're going to talk about that in a minute, okay? And it comes down here to the side of the femur, okay? And it's responsible for elevating the leg, okay? Bringing your leg up towards your belly just like this, and to an extent, side bending left and right, okay? If we have a muscle, one of these psoas muscles, is in contraction, it's in spasm, it may cause the spine to, say it's on the right side here, it may cause the spine to laterally flex to the right, okay? So if we have a psoas muscle in contraction on the right, it can pinch these nerves as they exit here, they just don't have as much room, okay? And that can cause radiating symptoms when these lower lumbar nerves are pinched that mimic sciatica, and you can see pain running down the back of the leg, sometimes into the feet, numbness, tingling, things like that, okay? And also if you have pre-existing disc injuries like disc degeneration, disc bulges, disc herniation, things like that, where the disc is already in a compromised condition, and you add to that a contracted psoas muscle, it can cause bulging on the opposite side. So you can have bilateral symptoms or symptoms on both the left and the right side due to an abnormal lengthening of the psoas muscle, okay? So when we see that in the office, we'll show you how we assess for it and 2 different treatment options that we can do to get that muscle to lengthen out so the pelvis is level and we have normal pressure on the nerves and the discs. It's really important to keep that muscle lengthened, okay? So how do we assess for a psoas contracture, okay? What we're gonna do here is have the patient lie prone on their tummy just like this. We're gonna bend the knee up. We're going to block the sacrum here, okay, to keep the pelvis grounded, and we're going to lift the leg up and find the point of resistance. We should be able to bring it past 20 degrees, at least past 25 degrees, and she's definitely tight on her right side as well. And let's check that left side here too, okay? So again, we're going to block that sacrum, lift the leg up, and this is much worse on the left side. She probably feels that here, okay? So what do we do when we see this? We're going to do a post-isometric relaxation release for this muscle. Okay, so this is a 2-person job. We have the patient and the examiner here. So we're going to bring this muscle up to the point of tension here, and then I'm going to tell Ms. Pinky to go ahead and drive your thigh straight down into the ground, and I'm going to hold here. She's going to apply about 30 to 40% maximum contraction. Okay, and I can feel her squeezing down. We're going to hold this for about 8 to 12 seconds. Okay, what this is going to do is kind of allow a neurological reset in the muscle that is going to allow the muscle to lengthen up fairly quickly. Okay, go ahead and relax here. And we'll let the muscle lengthen here. And we typically do about 3 to 4 rounds of this PIR type stretching on the left and the right, depending on which side needs it or both, okay? Now we're gonna bring it up. We can bring it up a little further already. This technique usually works pretty quick with all sorts of different muscles. Go ahead and drive down again. Pinky, good. Hold that. Good, and relax here. So we can let the muscle lengthen, but now if we pull it up, these PRR stretches work pretty well. We can see she's got a little bit better range of motion already after just 2 sessions, okay? And we could definitely go a lot further, but I just wanted to show you guys one of the techniques that we use in this office to assess for lower back complaints. And I also want to show you guys how you can do this on your own at home if you don't have anyone else to help you. So if you've got a tight psoas, this is just a stretch you can do just to get balanced out. You don't need to really have a medical examination to find this out. You can just stretch it on your own, okay? So let's assume the right side is really tight. We're gonna bend forward here, bring the left leg forward, the right leg is gonna be trailing behind, and you wanna lean right into that, and you'll already feel a stretch here, okay? I can already feel a stretch. We'll take the right arm straight up, and then we'll bend over to the opposite side, and you can feel a big stretch in the front of your abdomen here, down into that, into your thigh there, okay? And we can assess on the other side as well, okay? So this time we'll bring the right knee forward, the left leg's gonna trail behind, lean into it here, and this side definitely needs it more on myself. I feel a big stretch here. Left arm comes up and bend over towards the right, and you can definitely feel a stretch with that, okay? And that's a way that you can, at home, help to lengthen the psoas muscle. If you guys have any questions, please feel free to post them in the comments below. You can call the office for an appointment, 822-1010, and if you know anybody that can benefit, please share the video with a friend, and we'll see you guys back next week. Thank you.